approximately here. Now, you mark the midline, you go about 3 fingers to the side, and slip it up until it touches the lowest rib that you've marked. And this is your point of insertion. Now, for me, because of my fear of room fluxes, I'm going a little bit below this place. So in this case, I want to have about 3 centimeters away from the lung. Germans say 2 centimeters, I think that's too close. So I go a little bit down from this landmark, about my 3 finger breadth away from it. Again, like I'm moving it in. You see, it's not really supposed to be fingers. You know, the Germans don't go way out here. But the further you go out, higher your risk for pneumothorax. So I stay within 3 fingers off the midline. And then the procedure is very simple. The main thing again here is the right needle. With this one you want to have a 22 gauge minor needle that I recommend. And it needs to be 3.5 inches long. So it's the only needle that you can trust that doesn't deflect. I've seen some Germans do it with 25 gauge, 27 gauge type of needles, and they, you don't know where they go. You just don't. We've done some under fluoroscopy, and you need to have at least a 22 gauge, fairly sturdy strut to move. And then it's very simple. You interface local anesthetic around this area. You find out where the nipple is on the other side, and this is your point you're aiming at the nipple on the other side. You advance the needle, and if you're all lucky, you get straight through. Usually you hit the transverse process of the vertebra there, and then you can either negotiate your way slightly up above it or slightly below it. Usually you have to either pull back quite a bit and then move the skin, or no, his skin doesn't move, making me think of the Germany chronic leg pain. So you've got trouble around now too. If it doesn't move the skin, so it would be wonderful to treat it for that with some not a difficult procedure to do, and Alberto will agree with me. You know, it's very simple, and you're never going to see any problem with it. It's just a mental step that it takes. It's one of the easier procedures, really. Like if you follow the instructions, you put your needle there, and you trust it's going to be in the right spot. You put your local anesthetic, and you see the result. It's just for me, sort of teaching the sport that is to make it important. The only risk with this procedure is the rheumatoid. And always be aware of the rheumatoid.
What do you do?
So you get a rheumatoid. Well, the first thing I do is get an X-ray for the patient. I send the X-ray from the radiologist, who then gives me cost of blood, you know. It's a small shed there on the top of the lung. And I think we did it again. Had known it twice so far in the last 6 years. But it will have to you if you do some of the more recent procedures. Currently I have to do procedure, but I do a lot of upper neck kind of stuff, you know, breathing here, looking at the hospital drop. If you do enough of it, it will have to you. And the interesting thing there is the finer the needle is you use, the more unlikely the rheumatoid to close up. In my experience, saying that, I don't know. But whenever you work around the lung, this is really in any carbon injection therapy, the only component. I've never seen any serious carbon vascular injection. And I've been everywhere. Intrathecal injections, intraspinal injections. I've never seen any serious trouble. The only serious trouble you're ever going to see is rheumatoid if you don't pay attention to it. So all the injections around the lung, never underestimate how close the lung can be to the skin. Something that you never know. Obviously, if you have a history and an X-ray or so, some of the amazing ways how the lung can come up with the vein, and how some of it can come close to the surface, including the scoliosis, that you can see how close nothing is done with the No, this is with the lung, you want to stimulate it manually, and I cannot receptors that become more stimulated.
When I talked to Dr. Kuba, your anesthesiologist friend, I mentioned to him that about ionochoresis, in other words, driving the energy electrically through the body. And he said he was going to look into it, and I think it was serious. So when you hear from him, call me,
Well, there's
and then I'll let everybody else
two
know.
additional things I'd like to share with you. One, I met a very interesting physiologist from Brazil on the skiing, and he developed a way of using ultrasound to sedate cancer by basically pushing body away, holding the sphenoparasite to the way, and going to supraintravenous buffer, and aiming it at the sympathetic trunk. And he was doing 56 minutes a day with 2 watts per square centimeter. 6 minutes a day at 2 watts per square centimeter with normal ultrasound, and aiming it there. And was getting after about the third or fourth treatment, she regularly gets a good corner syndrome, and she gets a wonderful sedate ganglion from just about 10 to 15 feet. She had launched in the book. last thing today. Oh yeah, okay. There's two more things we're going to be doing. One is I want to show you the evaluation for neuroma in the foot, which is something I'd like to get all of you. I have you tell us briefly your history.
Let's see, I just delivered 3 months ago, and during my pregnancy I had a number of problems develop. But one thing, I had a tremendous weight gain. I gained over 65 pounds during my pregnancy. I was preeclamptic. I developed this sensation in my foot. Initially I ignored it, thought I had a small piece of glass in the sole of my foot. And this continued to bother me. There was a small place there. Continued to worsen. And then after I delivered, decided it was about time to do something about that. A friend of mine, a podiatrist, who scraped it, thought it was a wart. Couldn't find any glass there. It looked like it was a wart. Put some caustic agent on it, and it just seemed to cause the pain to spread out instead of being intensified in one spot. It spread. Then subsequently, over a period of a few weeks, it just seemed like the pain involved the soles of both of my feet. And obviously it was more than just a local phenomenon. And now then, it's almost crippling for me to walk. It's necessarily show all the time, particularly when I get up in the morning. It's all I can do is get away on my feet and have to hobble around and get going. I also developed, about simultaneously with all this, polyarthritis. So it went from kind of being at the bottom of my feet to all my joints hurt, all my muscles hurt, fluctuating between my feet. But everything is involved more or less. Also, after I delivered, since I was preeclamptic, I got a lot of IV, and I self-managed and IV, vitamins, minerals. And one of the IVs, I was in a hurry. I don't treat things like I take myself. I was in a hurry, and the IV is filtrated. I had a lot of ascorbic acid in it. And this whole arm is swelled up. All my hand, I couldn't use it for quite a while. And it seemed like perhaps that was somehow related to my sclerosis, my veins, really at all. And it probably took 2 weeks for that to go in. There was a lot of pain in the wrist. Kind of went along with all this. A lot was happening there. And I had a C-section for my delivery, developed infection in my C-section, and it opened manually. I dressed it myself, so it was granulated in. It's scarred. That's basically it. Last year they injected my thyroid, and I got a tremendous reaction. My side well, I had the emotional catharsis. Then I went from shaking chills to being calm. Just a number of things. It was about 2 hours. Oh, yeah, that was almost 2 hours.
You've got a static and you're wrong.
Also, the injection you were just talking about, I got the one, going through it. I don't know what you probably end up calling it, but when we were discussing with the pneumothorax. Yes. I was
Did you have your pelvic skull injected already?
Yes,
Yeah.
got that injected. What is it?
What happened after that?
Nothing more. Nothing else.
Little things, any little thing, painful. Like did you get a sore throat or any symptom that seems to be not related to it? Did you have anything in the last 3 days? Any little tiny health complaint? Any pain, like any increased foot pain, any increase in your pain, or really nothing?
I didn't have to see it. It was terrible to see.
So, like the neurotherapist here, I would challenge her to just kind of come up and do a little brief sort of brainstorming of what they're thinking of what you want to come up somewhere and sort of just kind of share your thinking on her.
Let me just ask one question that I never asked you, Melissa. When we talked about the phone last year, the family never got to see your X-ray. Were the wisdom teeth, did they come out?
Yeah, I followed up on that, and Ed got to see those as well. it.
They were impacted and they were removed.
No, I didn't do anything about it.
Ah, they're still in there?
Yeah.
Yeah.
Uh,
Now I recommended that it come, well, 3 of them all come out, right?
Right. But in the meantime, I stopped everything since I was pregnant.
Okay, so we definitely, have dug, unveiled a little bit here. My take on her was this, that the fact that she has a strong reaction to the thyroid one means to me that the thyroid should be repeated. If somebody has a strong release like that, like I indicated this morning, there's an indication to go back and do it again. But that hasn't been done, it's been done only once. Okay. The other thing is that of course the response she had to the thyroid, did at the time she have particular symptoms why this thyroid? Okay. Now did that change after the injection? How long? Okay.
she had last year, she had the combination of the suprapubic tranquilizer and thyroid. And that's what unchanged the whole catharsis.
Yeah. So she had obviously the correct treatment at the time. However, sort of like Alberto is thinking, I'm thinking, everyone else probably thinking by now, since the wisdom teeth on the same meridian as the thyroid and the pelvis is, that we feel that probably the whole trouble she had during the pregnancy was caused by the fact that the meridian still wasn't cleared. There was temporarily the blockage was relieved by opening up the energy flow for the thyroid and for the pelvis, but it couldn't be lasting since you had the impacted wisdom teeth with so many times putting a lasting block in a particular meridian.
And the scar didn't heal in first intention. That's another sign that there is something going
On the
around
meridian, something on the meridian is not working well.
I had a tremendous response to that too. Having euphoria.
So of course, on the stomach meridian, you have all kinds of internal organs also. You can temporarily unblock them by doing the upper sympathetic trunk. However, with her it seems that you're going to do some muscle testing on it. You may find or not that the wisdom teeth are an underlying factor. However, as I proposed to her yesterday, there's a whole new line of thinking that I have that of course is in a way on a more superficial level than the wisdom teeth. The fact that the pain in the feet and legs came on after the pregnancy, we can look at the pelvis and the thyroid, but we can also look at very simply mechanically at the feet, that she had to bear so much more weight that something may have happened in the feet. And I examined her yesterday, and she's got developed a wonderful neuroma in both feet that I want all of you to feel, so you have a sense of how to look for this. This test is called Melton's test, and I will show you a quick injection procedure. How to determine whether they infect the neuroma is causing the leg pain right now or not. And most of the time what I find, following all the other principles that we have, in her case, the wisdom teeth needs to be removed, the thyroid needs to be injected again, the pelvis needs to be injected again. However, once she's grown the neuroma doesn't go away once it's there. It's sort of like when you have a root canal, by doing all the other things right, the root canal doesn't go away. And the same is true with the neuroma. I found, unfortunately, that most of the neuromas need to be removed surgically in order to give this patient a pain-free existence from there on. Let me just quickly show you the test, and I want you to quickly maybe line up then, and quickly go by to feel how neuroma is tested for the good. But first look at how it tests as you sit there, so would you like quickly down and I would suggest that we do use the time while you're still here to also do your thyroid and do the pelvis, because it definitely needs to be done with you. And as quick as possible, you should attack the wisdom teeth. I'm going to quickly run through the muscle testing, if that's okay. I know we're running out of time, we're behind, but because we're dealing with human issues here.
Women are stronger.
injecting it really does. It's just, I don't know yet, there was some suggestion yesterday, somebody's injecting it with 4 years. We see where the drugs.
You only find this.
I show you because we're going to be treating her.
There's no pain stimulant done. She's not getting a pain stimulant
No,
done.
no. The test,
It's fine.
I show you now how to test for a pain.
Third and fourth toes,
That's where it was.
It doesn't have
Already the foot each toe.
no. The ones that are causing this particular pain are always going to in this place. If it's wrong elsewhere, you got it? Okay. Yeah. It takes a little playing with it to get the neck of it. So it's like a chiropractic adjustment. You need to have to play a little bit with it. Yeah. Not in our experience so far. But I know that by removing these, we're relieving dramatically the pain
No, you squeeze with your right hand, don't push with your left.
You know, there's something weird. She feel a mass.
Hey, every year she comes with something new.
Harold? Yeah. Mass is something we feel like it's moving alongside of it. Right, we're saying like you could really size, but you could really
You're going to be on top of the treatment. It's not a little stick, if you get it right, it's a big stick. So you get the squeezing together, not on the pushing rubber. And the big comes on squeezing together.
Yeah, it does.
Slightly,
It's the first thing I would get out.
It's a little neck, and you get the big one squeezing together on the bone, not on the pushing up.
Just let us know, yeah.
If you don't get it, don't worry about it, but try it on your patients until you get it. And you get it almost especially any chronic pain patient you have.
Not positive.
Actually, especially about the history of jogging or weight bearing, run with you and
What are you going to need to drink? 10 cc's? Half a gallon? I'm going to run out of stuff.
Then go back up here.
But I mean,
Now, I just want to say one thing. The sensation of glass that you had in the ear, that's a typical history of a sprouting nerve. That means there was a nerve that was developing unmyelinated sprout.
the pirate
And by, of course, by
energy level came up.
dealing with the toxic substances that are sprouting more.
Right at that moment.
Yeah, there should be a margin injected with some
But
phenols.
so, the scar didn't close. Disastrous. No, I mean, for the massive, her whole structure is lacking, this is lacking energy. And she has
Okay, we want to go now and
So, yeah.
treat this condition. Now, with you, we should have some pain that we can relieve some pain right now.
Because the wisdom is always
in a way I'm split now here because I feel we should do the thyroid, the pelvis first. Why don't we do this, if we do the thyroid, the pelvis, and then just demonstrate how I would do a test for the neuroma to establish whether it needs to be removed or not.
Forget it.
Yeah, okay. Let's do that. Okay, so anyone who wants to know how we treat the neuroma, and I just had a very dramatic case lately. There was a attorney from our town who had a 4-5 and a 5 and 1 herniated disc. He had one surgery in August last year that failed, and then he developed a cyst on the spinal, what do you call it, spinal sac, condylar sac, huge cyst in the back. He needed to go back in and surgically cut the cyst. It was a very difficult operation, and ever since then he was in a wheelchair. He was unable to move. Was sent to one of the major spinal centers in the United States, Phoenix, and I basically said, I'm sorry, you're in Canada, you're on record, I'm disability, but no more. And so he came to me, and I checked him out, and I did my normal procedures on him, and started doing chemotherapy, and the urine injection, started doing better with that. But it wasn't able to go back to work. And then, since I've just started doing this particular procedure, I started evaluating with some test injections that I'm going to show you quickly the injection size, which gave me complete pain relief for 24 hours. I mean, this guy didn't know what it was, he could not have any pain. Just by doing a simple injection on the leg, you got complete pain relief for 24 hours. Now with this procedure, sometimes you're going to see only 3 or 4 hours, and it's still indicated that the neuroma needs to come out. I sent him for the neuroma removal, removal of the leg. Neuroma that he had, that was good. Gave him complete that kind of immunity. Since then, complete. On the right side, it took about 30% of the effect. It's left in the morning with a thing like a screw or a pulley scale. It was great. But the most stunning thing, that was the first one of my surgery, my surgery was that this incredible pain that was bleeding from spinal cord compression, spinal stenosis, enabling him to do a scar tissue, then with contractular pain was completely relieved. Okay, this is how the injections go. First of all, we treat the tendon nerve, we treat the saphenous nerve, you take a 27 gauge needle, poke it in until you pass the needle tip, the position that mostly creates pain. You put about 2 or 3 cc of local anesthetic, move the needle around until there's no more pain in the area. Maybe up to 5 cc of local anesthetic. Then you do the lower position of the saphenous nerve. You do the point between gallbladder 34 and stomach 36. The area will be cold. You do the recurrent articular nerve, which is really kind of arterial on the inside, which is not so important. You For the pelvic, no, I have found stretch marks to be significant for muscle testing. This comes from the test points. There may be some that are, but as a general rule, I don't think they are. I think with all the scars that are significant, I think the emotional trauma around the scar is an important ingredient of loading the scar up with whatever it is. And I think that the stress marks come onto it assiduously without being connected to particular one single trauma. I think we're going to get loaded with it. What we should do is maybe do the thyroid, then go ahead and see, and then come back with another team for the later on tonight, they'll have it after we've done the main injections. When you get it ready, probably will. Maybe we can go back and do the other injections. Just see the leak, even though that release will never last, it lasts, at the most 24 hours. They just will have to test after the enrollment. But for me, since you're so much,
I've been working on this, but I've been working on it in a different way. And that would give results. Well, she's clicking. She's just tired to move.
so it's there. So you can proliferate.
Wiggling here. Now here, maybe it's firm. But in here, it's wiggling. And it's clicking. So I've been going here and proliferating and firming her up. Yes, and then for the bump, then I've been doing your spreading. For the bump, for the bump. And I find that I've done half a dozen people that have the surgery. Every single one of them messed up, and then you just do the spreading. And that gets them out of it. They get to feel
I
better.
think probably either sort of
Infiltrate a big amount. Nice thing.
interrupt the yeah, I mean, would you get me some? So, the last word is spoken on that, and I'm sure surgery is not the most elegant way of doing it. However, just to demonstrate to your staff that what is doing that and stop looking for these other humans how to do it. For the homeopath, there's an indication for freedom. You should definitely take the homeopath for good as a close relationship with powders. we'll do the shoulder injection while we're waiting for Melissa to into the bathroom. You okay? Because you don't feel any bad effects like
Teacher, only check $50 is going over that.
Yeah, bonus situation.
Actually, would you mind if you can print Does any, how about
Bob, did you ask about?
Oh, yeah.
Because we're going to fight. If they have a shot, we need to let it jump on it. I'll give you 5 10.
Well, when you asked the Romas, he was talking about the
Tal vez podemos hablar con ellos y a ver si por 2 nos hacen una rebaja.
Yo les doy 500 pesos para ustedes.
Well, you know, I guess the only reason you're doing that is because you think it being surgery is better than surgery. I mean, if you have this sprouting, it's causing 26, or it's causing these other distal neurological
Very big here with the.
irritation. Okay, final kind of stress. Okay, so you're saying stable. Yeah, no. You feel it's going.
Well, I ran into that, and I always think the guy must be right on.
Yeah, you say you feel like you have to touch. Yeah, mine like this. Not tremendous amount. A little. I never stretch. I'm good because I'm fit. Well, okay, well, yeah, it's just quite, it's a continuum. It's quite great. I suspect. I mean, the average person is that's the other, that's.
So are you using seal?
I have a lot of kids. Yeah, they are long.
To wheel it?
Yeah, it's not severe. It's not severe. Art.
So you just go and we have
When it goes to the capsule, the sucker is not going to feel good.
Mama, Papa.
Well, yeah, he's going to, yeah.
That Johnny and Jill did.
And then it's that 4 minutes.
Yes, I know.
Now, I had a picture of a gal that
Rick, give me a needle.
got 3 offspring.
You get to shoot this hunt, right? With the shirt off?
I wanted to get that picture for a TV file. She had all some I got her to
Brown.
We're going to do a shoulder injection, and I'm going to show you quickly on the healthy shoulder where the landmarks are, because those are very, very important. We palpate the spine of the scapula as it comes to the side, and it ends, it has a almost right angle to go forward. It goes like this and like this. Let me put a drawing on here. The spine comes here, and then there's an almost right angle going forward. Okay. Let me just come a little bit more up here. And your other hand palpates for the coracoid process, which is in this case here in the front. And your needle direction is you go 1 centimeter down, 1 centimeter in. This is the injection point on the skin. And the needle tip is pointed at the coracoid process on the other side. The arm position is the arm across the belly, the other hand holds his arm in place in case his arm wants to escape during the procedure. And you make sure that the patient is relaxed and doesn't contract the shoulder up into the capsule. So, again, you take the spine of the scapula, you find the edge, you find the little corner here. You go 1 centimeter down, 1 centimeter in, which gives you the skin injection point here. And then you point the tip at the coracoid process on the same side. And you use a 1.5 inch 25 gauge needle. Okay, workload is more major than most people think it is.
That's not
like one cavity bursitis. But if you do have bursitis, I'll show you the legal condition of bursitis, because it's very close to the other legal condition.
Melissa,
The exact same instructions from the corner that you had here, you have it 1 centimeter down, instead of going 1 centimeter back, you go a little bit more, 1 centimeter up front.
fabulosa violeta la ciudad de Bogotá.
25 days in, and then you go in, the surface, same angle, and you sort of fan it around in this direction. And it gives you a dramatic improvement. There isn't a single on the surface. You usually have 1 feet. So, it's the same at the angle here.
Ya lo llamó Las Vegas. Sí, que si había salido
You go that centimeter down. And you don't want to be in the middle, it gets very difficult. You want to be between the middle and the back, closer to the back, about halfway. Any point on this line is okay, but when you get back here, it gets difficult to get close to the end of the person. And if you get up here, it gets very difficult. And that's a position I tried for years, and it just didn't work as a I use again and with these two techniques, of course there's a ligament in there, infraspinalis, subscapularis, but any adhesive form of any restricted shoulder would be one of the two.
I didn't know.
Sure, you can see.
I was absolutely amazed. I wouldn't have touched you if I had known that your wisdom teeth are still in there. I was, you have to think of this. Anything at all. Until these things are on. Nothing, not even touch it. It's throwing the money down the drain. That is now you understand why that scar never closed. Why you had all those problems, metabolic problems.
By taking the elbow across to the arm.
Why?
You got 3 burn fuses, my dear. All the light all down in all this neighborhood is just, you know, like this here. I can do disco, cheap disco.
There was one carrying after the same, you want to take it.
Because in the sophisticated one, then it goes, yours is.
She's definitely not get those 2 vision. It's not like one of
I feel pretty bad. I don't know if most people can't tell, but I just barely make it. I need to get out of bed. I need a wheelchair to get out of bed.
Probably the same as he works in class.
No, you have to get your energy out of it. Doing anything, Melissa, doing anything right now, we can do anything you want to come. That is the situation. People have this most of the time.
Other positions is going to very better.
It sort of goes, but it starts smelling like burn, you know.
the brakes. It's like some of the big alien going down some of the mountains there in Arkansas.
Probably after we get
Because usually, I mean, most shoulder
I wouldn't wonder at all. You need to just like 4 months after removing
That's
it.
usually all you want to get.
Really?
And then if you sort of go with that,
And my wife after we removed another thing that disturbed was she was 9, she was 18 pounds.
Melissa, see if someone coming on that. Ed, would you,
I guess they had,
would you draw up
he has a plan for in the morning. But if not, there's a.
You want a,
Dental surgeon that was Harrison got kicked off.
Yeah, yeah. Well, that's good if he understands.
He works with it.
Right.
Yeah, he works with it.
Because a normal surgeon will take them out.
Yeah, yeah.
What do you want to take them out if they are in?
Yeah, yeah, exactly, exactly. Well, he still thinks John's a little bit weird, but still he's trying to understand. He has an open mind, so when John says, "Well, I want this one out," at least he goes over it. I don't know what it is. He may have another
I'm gonna play golf tomorrow morning and I get the hell out of here. I have to fly to San Mateo, San Clemente tomorrow afternoon. And then I have a meeting there the day after tomorrow for 2.5 hours and then go to Miami. Back to work. No, it's not in Fremont anymore, it's in San Clemente.
Oh my God. 400 miles off.
Yeah. I hope I don't meet Nick.
He might be socially a very nice guy.
Yeah, we have to fly to Orange County then. And from there on, just rent a car and drive over. It's about 40 miles.
Oh, it's not very far. Go out to Santa Ana Freeway.
Yeah.
San Juan Capistrano and then Santa Ana, a little bit farther. Oh, that's a shame.
Yeah, they changed the ownership and then they moved down to San Clemente.
Do they have the same telephone number? Too bad you call before you win. I'm gonna, John Char called me while I was in Minnesota last week, and I didn't have time to call him. I'm gonna call him.
You make sure and tell him that you better make sure you tell him that I send him my love and my regards. I like him very much.
Oh, I did. That little kid of his is dynamite.
Well, I never got to know his kid.
Oh. He's a little tiger.
I never got to meet
Kid
him.
is smart as hell.
You give him my love. I remember him very much. I hope I'll be able to get to Hawaii sometime to see him again.
Yeah, I think he's finally getting it together. And he's finally gave up after the goddamn lawyers just ripped him off and the judge dumped him and everybody was on his case. It's funny, you know, Gary North wrote an essay called The Age of Envy, where nobody wants anybody to achieve anything, you know, and you get a guy that's an achiever and he's up and it's all the guys trying to shoot him down. I think that's what happened.
That's very typical.
Try to.
Very typical.
It's been a hell of a meeting. I'm really enjoying this.
That's great.
How did they get a hold of you guys and get you here so quick?
Well, I mean, we have been in touch with Ed on the phone since last year, and we keep on communicating.
Yeah, I know, but did he find out?
Say, many thanks for the communication.
That's great. I'm glad you enjoyed it. Take care. We'll meet somewhere down the road. I know it. I know it. Okay.
But how long before did he know? Were you going to be here anyway to translate, or what?
Yeah, we were planning to come with Hopfer.
Oh, I see.
And then Hopfer canceled, and I said to Ed, listen, I'm going to try to put together whatever, and I make myself responsible for 3 days. You know, I take over 3 days, with whom I don't know yet. And we spend the last 10 days every night till 2 o'clock in the morning with Arturo putting the things together so that we could come up with something decent.
My God, how did you, did you, what, did you have a computer that you made those slides with?
Yeah. Well, we had most of them, you know.
Oh,
But I mean, I wanted some specific topics just to replace Hopfer, you know, because we have a lot of topics, sports, and preparation with biological medicine and EAV and whatever. You know. But I wanted it to be more the scientific part of the neurotherapy oriented. And it was a hell of a work, and I said to it, I won't let you know. I mean, we'll do it more so. If we love Hopfer so much, we can let you down. So here we are.
Arturo's really impressive. He's sharp.
He is very, very smart. He's a very, very nice guy and very humble, very good professional.
Yeah.
He started with us as a kid, you know. I mean, he was in second year, I guess, and he came because of his damn asthma. You know, his father is a very big top-notch surgeon in Cali. His two uncles, and they have never been able to do something for his asthma. He was taking Ventilan and all basal dilators and bronchodilators, and then he got convinced of this, and then during the rest of his studies, every Saturday he came to work at our place from 5 o'clock in the morning to 5 o'clock in the evening, and Sundays too, because we worked every other Sunday then. And he got enthused, and when he finished, he said, well, this is what I'm going to do, and this is it, you know. And he's very smart and kept on looking for himself, and there he is now. We're very proud of him.
jump right up when he has his posture. I'm back there going like this.
Didn't see me.
He just missed you. I can tell.
Let's try with the main line. Because I know the Germans from the inside out, and the Germans are very loose about things. Because of a very different legal situation. They grew up, they don't have any side effects of that.
That's what I do. That's my job here. Where's it going?
Usually I take the same needle.